We are going to follow Max, who is getting admitted to start his bone marrow transplant. Today is his first day on the bone marrow transplant and immunodeficiency unit. Everyone needs to wash their hands thoroughly prior to entering the bone marrow transplant and immunodeficiency unit. This helps keep our patients safe. Storage space is limited in the bone marrow transplant patient rooms. Please pack accordingly and avoid getting too much luggage. This is the nurse server, a workstation where the nurses will prepare Max's medications. It's important to keep this space free of any personal items. Your child will have means to use his or her personal electronic devices and have a television in the room with several appropriate channels. Please keep all items off the floor to allow for a thorough cleaning of your room. Our cleaning crew is not allowed to move any of your items off the floor, so please do this in advance. Also, we try to keep all patient items off the floor, especially if they are intended to go back into the bed and cannot be immediately sanitized. Now let's show you around the unit. Here's the parent lounge where you can eat your meals since you are not allowed to eat in your child's room. You can store food you bring in for your child or family in this refrigerator. Make sure you have your name and date on the outside of the Ziploc bag. Meals may not be cooked on the unit, but you can cook food for your child at home or order a freshly prepared meal from the cafeteria for your child. This is our washer, dryer, and showers for parents. This is an exercise room for parents and caregivers to use. All these areas are for parents only, not for patients, siblings, or visitors. Siblings are not generally allowed to visit patients when they are going through bone marrow transplant, and the rules are stricter during the influenza season. Patients are not allowed to leave their rooms during bone marrow transplant. This is our nutrition room for patient snacks, drinks, eating utensils, and ice water machine. Snacks in the nutrition room are available for patients' use 24 hours a day. Please do not congregate in the nutrition room. It is helpful to prepare questions you have related to your child's care for the next 24 hours. You can either ask the questions yourself during rounds or give the questions to the nurse if you are unable to be there in person. Your nurse needs to check your child frequently during the day and night. This frequency could be more when your child receives certain medicines, blood transfusions, and chemotherapy. Everything is for your child's safety. We focus on your child's overall health with various services during the day. Bone marrow transplant is not surgery. The transfusion does not hurt. The donor cells go into your child's body through the IV and find their home in your child's bone marrow space and start to grow. It takes 2 to 3 weeks for these new cells to grow. It is common to have some high blood pressure during this transfusion. This is controlled with medicines. Interfaith chaplains are available to bless the stem cells. Families find this comforting. It is common to not want to eat after bone marrow transplant. This can sometimes be because of mouth pain from the chemotherapy. There are doctors specializing in pain management who will take care of your child. Your child will get all the calories he or she needs through nasogastric feeds or intravenous nutrition. Once his donor cells come in, he will feel much better and start eating again. It is common to have fevers during the early period after bone marrow transplant, and your child may have extra labs and blood cultures drawn as well as antibiotics started. Sometimes we need to monitor your child more intensively to keep them safe. This may be done in our intensive care unit. This may require the treatment team from the intensive care unit assess your child's needs so that appropriate management changes can occur. Even if your child is in the intensive care unit and you will see a new team of doctors and nurses, the bone marrow transplant team always follows along. Once your child feels better, they will come back to the bone marrow transplant and immunodeficiency unit. Even if you are back on the bone marrow transplant unit, your doctor may involve other specialists in your child's care. Several simple measures help in preventing infections, such as doing daily oral care 3 times daily, taking a shower daily, and getting out of bed twice a day. We look at laboratory work daily, and you can too. Ask your care manager how to get a MyChart account so that you can also follow your child's labs. Once your child's blood counts recover, we send blood work to determine what percentage of your child's blood cells are actually donor cells. The donor cells take some time to settle down, and during this time, your child is at risk for graft versus host disease. This can show up as a rash, diarrhea, or jaundice and is treated with steroids and other medications. We plan 1 to 2 weeks ahead and get a lot of teaching done before discharge. Your doctor will determine when it is safe for your child to go home.